Hi, I'm Alana,
Hi, I'm Michaela.
and today we're going to be showing you various muscles of the pelvis, thigh, and knee.
So the first muscle we have in the quadricep group is the rectus femoris, which origin is the AIIS, the anterior inferior iliac spine, which is right there, and the insertion is the tibial tuberosity via the patellar tendon, which is right here. The movement is that it flexes the hip. The next muscle we have in the quadricep group is the vastus lateralis, which is the most lateral beside the IT band. It runs from the head of the femur, which is up here, and down to the tibial tuberosity via the patellar tendon. The movement is that it extends the knee. More medial into the quadricep group is the vastus intermedius, which runs, again, from the head of the femur down to the tibial tuberosity via the patellar tendon. And the most medial is the vastus medialis, which runs from the head of the femur, which is right here, down to the tibial tuberosity via the patellar tendon. All the quadricep muscles extend the knee, except for the rectus femoris. In order from medial to lateral, we have the gracilis, which runs down the inside of the thigh. Then we have the adductor longus, which runs down from here. Then we have the adductor brevis, all of which help the hip abduct. Next, we have the adductor muscles, all of which have the origin of the ischial tuberosity.
Ooh, that's that one. Yes, his supraspinatus is the first of these trees, and then deltoid.
And run to the adductor tubercle, which is on the femur. We have the more larger muscles of the front of the knee, which is the sartorius. The origin is the ASIS, which is right here. And it wraps around the quadriceps, and its insertion is the proximal medial shaft of the tibia. The movement is that it flexes the hip. Next, we have the tensor fasciae lata, which is the muscle that runs down the lateral side of the leg. The origin is the iliac crust, posterior to the ASIS, and the insertion is the iliotibial tract. The next three muscles are a part of the hamstring group. The bicep femoris is the largest muscle in the hamstring group. It runs from the ischial tuberosity, which is right here, down the shaft of the femur to the head of the fibula. Its main movement is to flex the knee. Next, we have the semitendinosus and semimembranosus. The semitendinosus and semimembranosus are both a part of the hamstring group as well. And the semitendinosus runs from the ischial tuberosity and to the posterior aspect of the tibia, which is here. The semimembranosus is a little bit bigger, and it runs from the ischial tuberosity, which is here, down to the proximal part of the tibia. These two muscles have a movement of extending and externally rotating the hip. Now I'm going to show you the ligaments of the knee. First, we have the patellar tendon, which is not a ligament, but it is very important. We have the ACL, which is anterior to the PCL, which is at the back. We have the MCL, which is the medial cruciate ligament, and the LCL, which is the lateral cruciate ligament.
I'm going to show you the gluteus medius, which starts on the ilium and runs down to the greater trochanter. So on a human, it would be the ilium and run down to the greater trochanter. And it creates hip abduction. The next muscle is gluteus minimus, which starts below the gluteus medius, which is right here on the bottom of the ilium, and goes to the front of the greater trochanter. So it would be here and up front more. And it creates hip abduction and medial rotation of the hip. The gluteus maximus, which starts on the iliac crest and sacrum and goes to the greater trochanter on the back side down more. On a human, it would be here and go down to the greater trochanter here. And it extends the hip. The next muscle is the piriformis. Its origin is the anterior sacrum, right in here, and its posterior trochanter. And it creates external rotation of the hip. I can't show the inside of her sacrum here, so I'd run on the anterior side, so inside, and go to her greater trochanter here. The next muscle is the iliacus. Its origin is the iliac fossa and the ala of the sacrum, which is here and here. And it runs to the lesser trochanter of the femur, which is in here. It creates flexion of the hip and externally rotates the hip. On a human, the origin would be here on the inside of your pelvic, and we'll go to your lesser trochanter of your femur.
Thanks for joining us. Hope you enjoyed.